because this is a important briefing that we do to keep our community notified of what's going on with COVID, with our results, and our upticks are when we go down. So thank you to everyone. And we'll get started with Lisa Watkins, President of the Martinsville Henry County Chamber of Commerce.
Good morning, everyone. And I echo Sharon's gratefulness for everyone being able to join us this morning. And I'm super excited this morning because we've got a lot more tools in our toolkit to keep us safe and get us back on a path towards normalcy. And I'm just looking forward to a great briefing today with lots of good information from our resources. And so thank you, and I'll get out of the way.
Okay, thank you very much, Lisa. So next we'll go to John Turner, who is over public safety for the city of Martinsville. John, thank you for joining us today.
Not a problem. Glad to be here. As far as numbers go, I was just looking over our call counts. We are not at the levels that we were at the beginning of the year. Still up there, but looks like things are trending down somewhat. So that's a positive reflection of what's going on in the community.
Thank you. Is there anything else you'd like to add from the city?
Not at this time. We're still going through and taking it one day at a time. I know people are asking about boosters now, and maybe the health department or the hospital could chime in on that.
Okay, thank you. I know, John, in the past, I know you have worked with the health department where you guys have done the clinic at the Armory. Are you guys still doing that?
So we're not hosting one at the Armory. I had talked with some people at the hospital, and there was one being set up at I believe at the Speedway this week.
Okay.
As far as partnering with anyone, it looks like it's in such abundance out there that people can go anywhere and get that booster. But if we see the need, we can possibly ramp something up and start that again if needed.
Okay, thank you, John. And so we'll go to Henry County and their public information officer, Brandon Martin. Thank you, Brandon, for joining us.
Thank you. So not a whole lot has changed from the county standpoint since we last spoke. The county did hold a vaccine clinic for our employees that wanted a booster shot on Friday. Even though it was kind of thrown together last minute, we still had a pretty decent participation in that. We had about 50 people, I think, receive their third dose. So pretty happy with that. And just besides the boosters, we're still encouraging those that haven't received their first dose to do so. We really want to see those higher numbers in that area as we enter the cold months. That's all I got.
Okay, thank you so much, Brandon. And so we will move to Sova Health. And I'm not sure if Haley, Spencer, or Dr. Ganolan, who wants to speak first?
It doesn't matter. I'll take it.
Dr. Ganolan for joining us.
Absolutely. Sorry about my tardiness, trying to juggle. But so Haley gave me the latest numbers across the market. We have just over 20. I think it's actually 21 people across the market currently admitted for COVID-19. 80% of those about are unvaccinated. I think that continues to speak to the fact that the vaccine does work, does help. And we continue to see, we talked about a year and a half ago, these were people in their 80s, 90s coming in needing hospitalization for COVID-19. And that's just really not the case these days. 20s, 30s, 40s, you name it. We continue to encourage vaccination across the hospital, booster shots, as well as within the community. Most recently, our COVID-19 update for the hospital that Alan Larson and myself did also made a plea to the community as we realize one-on-one conversations go a long way still. And we're happy to have those one-on-one conversations, whether it's small groups. We know religious leaders still have quite a big impact in conversations with the community and or other public leaders. Happy to have those conversations. I'm happy to answer questions. So if there is that desire or need, Haley would have the touch point email to reach out to that. With all of the information, it continues to increase with false information. And, just past Halloween, I can't say the number of Halloween costumes that were reflected to result in some crazy side effect of a vaccine that doesn't exist, that really we can laugh at, fine, but it just promotes fear. And at this point, I'm tired of it. We are 2 years into this, and the number of lives that have been lost. And now we are sitting at a position where everyone in this country aged 5 and up is able to get vaccinated. Everyone in this country, 5 and up, is able to get vaccinated. It's free, it's readily available. Pfizer at this point is the only for those 5 to 11 that has been approved. I do expect Moderna to have one shortly. Pfizer is just a little bit ahead. It is a pediatric adjusted dose of vaccine, but 5 and up. On a personal note, as someone who has had a grandchild in a pediatric ICU because they got COVID and had the multi-system inflammatory response syndrome, a vaccine would have prevented that. 5 and up. There's no reason lives should continue to be lost to COVID-19. As we move into the holidays and everybody wants to gather, realize that your family gatherings and gatherings with friends can cost lives. If you're not vaccinated, if it's not done safely, people will get sick and lives will be lost based on simply wanting to gather.
Friday from 1 to 5 p.m. And the link to sign up for that is on our Facebook page. We will be offering Pfizer and Moderna at that clinic, and we're welcoming first doses, second doses, as well as boosters.
Okay, and that's on the Martinsville Sova Health Facebook page.
Yes, correct.
And I will share that with chamber members. Thank you, Haley. Lisa, did you have any particular questions you wanted to ask about the 5 and up?
No, not any questions. Just if someone could speak to just the safety of it. I apologize. For some reason, I got dropped out of the Zoom, so I may have missed that information.
So when it comes to the vaccine for pediatric or adult, safety profile is about the same. We are not seeing any side effects of this vaccine. Again, I continue to say these are the safest vaccines that have ever been made and put on the market. And I really would like to hallmark the side effect of COVID and that age range. We classically hear that COVID is less severe for those that are in the pediatric population. But what we're starting to see is a higher trend or incidence of what we call a multi-system inflammatory response syndrome that is leading to a lot of pediatric ICU admissions and even costing lives of those pediatric patients. This is never something that, not a trend that anybody wants to see or hear. And the problem is that the mainstay of support, just like in the adult population, is just symptomatic management and support. There's no fix. So prevention of infection remains the hallmark. It is a pediatric dose for those patients. Just smaller body doesn't need as big of a dose. So I will say it has been dose adjusted for that measure, but there's no patient population that can't get vaccinated as long as they're above the age of 5. So everyone is eligible and vaccine is readily available. The country has made sure that vaccine is readily available for everyone over the age of 5.
Thank you. Did anyone else have anything they would like to add before we go to our media partners? Okay, if not, Callie Heidela with the Henry County Enterprise. Callie, do you have any questions for anyone today?
I absolutely did. And it's one of those things where the moment you call on me,
I can come back to you.
hang on, I think I can get back to it. Well, one of the first questions I have, if we're talking about a pediatric dose, I know that it's adjusted for those smaller little people, but it does have the same level of effectiveness and same time frame of length of effectiveness. Do we expect that young people will also eventually need to get boosters?
Our hope is that boosters go away as more people get vaccinated, mutation possibilities and chances will decrease. The more likelihood COVID can infect just provides more opportunities it can mutate. So as we've gone through this, the reason we're at booster status now is because mutations of mutations of mutations at this point. So our hope is that now that we can vaccinate everyone 5 and up, that we would see this less likely. There's going to be school age range and those that are in school, and do they vaccinate, do they not, and is it required, and all of that information. But as far as effectiveness, it's the best vaccine you could give a child at this point, and again, save a life. And also protect the household. You know, there's a lot of multi-generational households, and I think it's important to touch on that. You know, if you've got young children living in a household with someone who is potentially at higher risk based on a higher age or other comorbidities, you're protecting the household by getting those children vaccinated as well. Saving their life, yes, but also saving the lives of and making it less likely that you'll expose or infect someone else in the household.
I remembered it. It dealt with boosters. Are boosters still being given out on a kind of, I guess, wait until it's your turn again basis? Like, I know last I think I heard was it was still people who are immunocompromised or 65 and up get boosters, but has it yet, or will it soon become, if you want your booster, go get it?
Yeah, I think we're really close to that. It has varied by state, just like vaccine rollout itself. Boosters are readily available. And so at this point, most people that want their booster is finding a way to get that booster. We do encourage those that are 65 and up, obviously immunocompromised. And then there was another news story that said those that are immunocompromised may actually need a 4th shot 6 months after they get that other booster. But yeah, booster, because vaccine is so readily available, commercial pharmacies, things like that, even with specific guidance that's out there, it's just there's a surplus of vaccine, and most places feel like we would rather this vaccine be in an arm than expire on a shelf and have to be trashed. So I encourage anyone that wants a booster, it's been more than 6 months since your shot, start having that conversation, start looking for availability of vaccine. Again, there's such a surplus of vaccine at this point, and I'm very thankful to be in an area where we have that. I have friends across the world that are still waiting for their first shot. So.
And finally, can you talk a little bit about the advisability or inadvisability of doing kind of a mix and match with the boosters? Like, if I got my Pfizer and I get a Moderna booster, am I gonna just be encased in this glowing shield of protection?
Yeah, so based on countries, they've done it a little different. To be completely transparent, in the UK, the population didn't know what shot they got, all the shots, because there wasn't one manufacturer that was readily available or more than the other on a consistent basis. All vaccines were thrown kind of into a bucket, and you got your first shot, and 42 days later, you got your second shot. There is not a harm by getting a different brand, particularly, we say mRNA. If it's a Pfizer and then you got your second shot of Moderna, based on what was available, that there's not an opposed there. It's not a bad thing. It's not the end of the world. You'll be okay. And in fact, you'll still get that same immune response. Slightly different variations in the dose of the vaccines between the Pfizer and Moderna vaccines. Moderna is a larger dose. That's the reason that booster is actually a half dose booster. And I say that only to say that you may have some different symptoms. If you had one type of one vaccine and didn't have availability of that other type and did mix, you may have a little bit stronger symptoms, which is really the reason we encourage everyone to stick with their same brand. Your body's used to that. Less likely to have some of those other just increased body aches, fatigue, headaches, all that same stuff that comes from that second shot is what's expected with a booster. But we don't want anybody to have that and then be afraid to get a potential shot in the future. And that's what we see is as people get so fearful of these symptoms, it kind of is that negative reinforcement to want to do it again if needed. And that's what we don't want to happen. There's no harm to the body. You're fine. Some people, for the sake of science, during research, have done it on purpose. Their bodies are fine. Everybody's fine. It works the same way. So I want to make sure that we get really worried about those things. And a lot of that is because we have the ability to be worried about those things, but in many countries they do not. And they are not worried about those things, and everyone did fine.
Thanks so much. I think that's all I've got for this week.
Thank you so much, Callie. So we'll move to Bill Wyatt, who is with the Martinsville Bulletin. Bill, do you have questions this week?
Yeah, I got a few. Callie, I'm having a birthday tomorrow, and when you get to be my age, you actually forget the questions, then you remember them again, and then like when you go first, I've forgotten them again, and I've thought of new ones. So, and on that note, I do want to mention that since our last COVID briefing that we've had, I had a gallbladder attack. Ended up at Sova Health emergency room, and ended up having my gallbladder removed. And I spent 4 days in the hospital. And kudos to the treatment. I was very impressed and very thankful for having a local hospital to go to and save my life once again.
Thank you.
All right. A couple of questions, and this would be Dr. Nolan and to John Turner. I know that we've been speaking of the need for diversion occasionally, also the EMS requesting that people make sure it's an emergency before they call. It appears, just listening to scanner traffic, as I typically do, that those calls and maybe volume is decreasing. Can you, each of you, speak to that, and is that situation improving for you?
John, I'll let you go first. You're fine.
All right, so just looking at the call data, I don't have everything broken down in that detail yet, but we are at a lower level than we were at the first part of this year. Looks like in first quarter we were pretty high, and it has dropped off since then. So maybe that's working. Maybe people are heeding that advice and only calling when it is an emergency.
And from the hospital's perspective across both campuses, really having people not coming in just to get a COVID test, the work of the health departments in both communities has really helped that with the testing centers that have been set up. And I know in that area, they've done an amazing job of making sure that tests were readily available. That has helped with just foot traffic coming in the ER, keeping it from getting completely gridlocked. But as you all know, things change here by the hour. So we continue to do routine pulse checks of our own facilities, making sure that everyone's on board. EMS is updated as far as where we stand and things like that. Happy to see that our COVID volume is decreasing. We continue to see other routine health emergencies coming in, but we're just happy to continue to be able to serve this community.
Great, thank you. Brandon, you mentioned, and I didn't hear the number, that you held a vaccine clinic Friday and had a number of people to get a third dose. How many people did you say that was?
It was approximately 50 people.
50, okay. And that's out of a building of how many people?
I don't know the total number. I know we have about 70% vaccinated at this point.
Okay.
But I don't know the actual total number of people who come through here on a daily.
Okay, and let's see, I think I had one more. Oh yeah, Lisa, I was with you. I got disconnected about the time that Sova was, I think, mentioning some vaccination clinics. Could you either repeat that, or if that's available on the website somewhere, where can I get that information?
Haley, you want to step in?
I got it, yes. So we are having a clinic this Friday, the 5th at the Martinsville Speedway. It's from 1 to 5 p.m. and we will be offering Pfizer and Moderna. And all of that information is on our Sova Health Martinsville Facebook page. The link to sign up, all of that information is on there.
Right. All right, that's all I've got. Thank you.
Thank you, Bill. Does anyone have anything else they need to add?
I just want to say thanks for all of our healthcare and first responders being so diligent over the last 2 years. And thank you to our media partners for helping us to get the word out. We promise at the Chamber we'll continue to try to help with disseminating the scientific information, and just thank you so much. I'm super excited on a personal level. My granddaughter is 5.5. That half is really important to her. And so she gets vaccinated on Sunday. And I just encourage everyone in our community for us to just all do our parts in keeping one another safe. And thanks so much. And we look forward to getting back to, playing on the playground and gathering with our families without so much worries. And only we can do that. Individuals in our community can make that difference. So let's all join in and make it easier on our first responders and our hospital staff. They're working so hard for us, and that's the least that we can do. So thank you so much.
Thank you, Lisa. And I do want to thank all of our partners, our medical partners, our community partners, and our media partners, because it takes all of you guys to help make our community well and to also get the information out to our community. So thank you very much for everything you're doing, and thank you very much for joining us today.